But now I can welcome you to this session. Good morning, everybody, and welcome to our session on investing in health security for a resilient European Union. My name's Nick Fahey, and I am very glad to be here together with the colleagues from the ECDC in this session this morning. We've talked a lot about renewing Europe's social contract. But one of the most fundamental elements of Europe's social contract is a trust in the institutions and people that keep us safe from threats to health. It's an essential part of what we expect as citizens from the health institutions in Europe. But we know the challenges that this represents, not only because of COVID, because of antimicrobial resistance, because of all sorts of different pathogens and conditions, and we focus on the communicable diseases within that, but we've also heard a lot, including from the Commissioner this morning, about threats to health which are interlinked from a range of different sources. And in order to meet those challenges, we need to have the infrastructure, the investment, the capabilities, the skills, and the information and data in order to be able to rise to those challenges. And what do we need? Well, that's going to be the subject of this morning's session. So in a few moments, I will invite the director of the ECDC, Pamela Rendi-Wagner, to come and introduce this topic for us. We'll then, fair warning, colleagues, will then be coming to you to ask for your questions about your input on what would your priority be for investing to ensure resilience. So think about what your answer to that might be. Then we'll be joined by an eminent panel of speakers who I will introduce once they come up and join us on the stage. And as I said, we will have an opportunity for you all as well to contribute during this morning's session in order to bring your contribution to what we need to ensure resilience in our health systems and to ensure a resilient European future. So that's the outline of the session. We look forward to your active participation, but first of all, Pamela, may I invite you to come and take the stage.
Thank you, Nick. Thanks to all of you for coming, for engaging with us at the ECDC, and welcome, ein herzliches Willkommen, and welcome to our ECDC session here in Gastein, which is actually already a tradition, looking back in the past years. As Nick has already said, and as we have discussed in the past 2 days, actually, health and health security is not a luxury. Sometimes it's dealt like this, and it's certainly not a nice to have. It is more a cornerstone, actually, of Europe's future. And as I said yesterday, also at the panel, we should be proud. We should be proud on our achievements, of our legacy, and what our European health systems have achieved over the past 50 years compared to other continents and other countries outside the European Union. So now, our way forward actually is to ensure that we sustain what we have achieved and what we have learned. And I think this is essential. And actually, we are in the lucky position that we have learned our lessons from the last pandemic. Before COVID-19, we didn't have these learnings on the table. But, I mean, learnings is one thing, and to use these learnings and implement it into action, this is another thing. We should as well continue to adapt and build modern public health systems which are fit for the future. And I'm so convinced that our public health and our health systems in Europe and the social contract is not broken. It just needs adaptation, constant adaptation. I mean, it's decades. I mean, new challenges. The world keeps turning. So yes, we have to constantly have an eye on it and adapt it. Systems, public health systems in Europe that can stand the test of time. We are all aware of that. We have been discussing this in the past 2 days, and the question now is not, should we do it? It's actually, how should we do it? And one of the key learnings from the COVID-19 pandemic was recognizing the high importance, actually, of a stronger, bolder collaboration. at all levels. Collaboration between the member states, within the member states, between the European institutions, and then between the institutions and the member states, between agencies and the member states. This is something which is really the basis, the foundation of a strong social cohesion, of a European resilience against any threat, not only public health, actually. So we recognize the critical need to work closely together at all levels in a trustful relationship, united. It's the trust we need. If we mistrust each other, I mean, forget it. There's no collaboration. So all our achievements will not work out. So now more than ever, close collaboration is even more important in the increasingly complex global environment we are navigating. And Nick has named some of them. Geopolitical tensions, no question. Climate change, growing social inequalities, and the continuous rise of mis and disinformation, mistrust in science, in politics, and institutions. Only some of the challenges we are facing and which will increase, most likely in the future. Yes, and one thing is sunshine clear to me and to us, these challenges cannot be tackled by one country alone. This is not a big message, but you need to say it again and again. It cannot be tackled by a single region and not by a single member state. And as the European Union and national actors, we need to work closely together more than ever before, smarter than ever before. The European Centre for Disease Prevention and Control, ECDC, was established 20 years ago, so it's a good year for us. We have a 20-year anniversary, and the foundation 20 years ago of ECDC was based on the values of keeping entire populations and fringes of society healthy and protected in the spirit of solidarity. We know that underinvesting, and this is the topic also for today, that underinvesting in health, in public health, not only costs health and lives, it weakens economies, it erodes trust, as we still see with decreasing vaccination rates all over Europe and other fields. It weakens societies, it weakens democracies. So the question is no longer whether we should invest in health security, but how boldly we are willing to act. What will it actually cost us if we do not intervene? All this will be discussed today, hopefully, if we do not invest. So health security is much more, as we all know, as we are all experts in public health, is much more than the absence of illness. Therefore, health security involves bringing to the table not only public health, not only disease prevention topics or pandemic preparedness issues, but also health economics. This needs to be on the table when we talk about investment in health security. Also, policy action across all different sectors is needed very urgently. And these are all key elements to create finally a healthy, peaceful, and prosperous, resilient society in Europe. In ECDC session today, this morning, we aim to bring together some of these different relevant perspectives from political sides, from academia, from economy, from public health. And I look forward to these very interesting panel discussions with really outstanding experts from all kinds of different fields to bring in their perspectives to a big picture about health security. Thanks, and looking forward for the discussion. Thanks for coming.
Thank you, Pamela, for setting out that introduction and for outlining the importance and the range of the issues with, if I may say after yesterday's plenary, your trademark optimism about what we've achieved, and a shocking optimism about what we've achieved and what we still can achieve. And let's continue with that spirit of optimism now. Can we put up the details for the Slido, please, colleagues? And invite you to express your opinion on. So here you have, so by all means, this is where I have to make sure that I'm not in the way of you taking part. So my question to you is, if you can only pick one, what single investment would you choose to build resilience into our health security systems in the European Union? What would... Still there, it's on that left-hand side. Right, I'm going to stand on this side. This isn't quite dancing, Charlotte, but I'm getting there. Good to see prevention going up there immediately. Workforce. We've talked a lot about workforce during the forum already, I think. Very specific. Vaccines, political commitment. Drones. Okay. I'm trying now to imagine what the role the drones are going to play. Diversify. Right. Okay. So there's a wide range of things. I can see that the panelists are going to have a lot to talk about in relation to that, which is a good moment for me to invite our distinguished panelists to come up and take the stage. Please join me in welcoming them, our distinguished panelists, to the stage as they come up and take a seat. So I will introduce each of you as we go around, and starting, I think, with, let's start at the political level, Mr. Kulja. Welcome, András Kulja, member of the European Parliament. The Commissioner has already talked about things like the multi-annual financial framework and both the opportunity and the importance of investment. What investments, from your perspective, do we need to build this resilience into our health security systems?
First of all, it's great to be here and always a pleasure. And I'm very happy that this slide will show the prevention and health literacy on the top of the list. And I think these two words are key, because what we are witnessing now is, Pamela mentioned this, that the trust in healthcare systems and also in our institutions is actually declining. I see four pillars as the main issues in Europe when we are talking about health and healthcare system. The first is the financial and economical environment. The second one is the regulatory environment. The third one is the shortage of healthcare workers, which is what is very, very serious problem now. And the fourth is the trust. And it's not, and I think the trust in healthcare system is key. So one challenge is to keep the budget for healthcare and health innovation, because it is part of Europe's competitiveness. And the MFF budget is still under discussion, and we hope that the budget for health will be a bit bigger. I hope so. But when we're talking about investment in prevention, for example, health literacy and improving health literacy must be part of the prevention, because without the trust, is not only difficult to sustain a healthcare system or vaccination systems in Europe, but also more and more politicians try to take advantage of this vaccine hesitancy, science hesitancy. And the problem is when they are start to walk on this route, it is a one-way route. And when if these politicians win the elections, they cannot turn back. And this morning I had a discussion when one of the panelists said that it is a loyalty test for politicians, what we see, because if they are campaigning with anti-vaccine slogans, then when they are in power, even they know that it was false and it was a low-hanging fruit what they could use in their campaign, they cannot turn back because their voters expect them to continue this route. So So, long story short, one part is we must secure the budget in MFF for healthcare and innovation and strengthen the cross-border collaborations and support our agencies, the ECDC or EMA, but also we should have a dedicated budget to strengthen the health literacy among Europe and European citizens, because they need the basic information to understand what we are doing and how research and science works. Because I think this is one of the biggest threats to Europe, because we can easily find our situation when we have the cure, we have the vaccines, medicines, but there is no willingness from citizens to take them or use them.
Thank you, Mr. Graham. I very much appreciate this. When we ask about investments, we talk about financial investments, but we also talk about a sort of social investment in terms of trust and understanding, which I think is a really important message. Charlotte, Charlotte Marchandise, as the Executive Director of the European Public Health Association, I think we've already heard about workforce and other issues. What are the key investments that you think are important to make?
Well, yes, the public health workforce, but in order to invest with for communities, because security starts with communities. Health literacy is in communities, and we can say whatever we want from Brussels, from Copenhagen, from Utrecht, where we are, but it's not how we reach out to citizens and the people who are the front line, and all these people and the community public health worker, we all training some of them for mental health, for HIV, in prison, and all of them, they don't feel part of this family. They're not invited to Gastein. Probably they don't know Gastein exists, and we don't get them here. And they are the front line. They are the people that are going to do their resilience. They are the people that are going to give water to their elder neighbor when we have a heat wave. They are the people that are going to protect their neighbor if war arises. And we need to invest in these people, and to do that, we need to invest in public health workforce at the whole family, healthcare, but also science, but also practitioner, and also community public health worker. And that means investing in training, real capacity building with badges that we share with the public health community, scientific pathway. We stop doing 101 training all the time on advocacy. We do 202 and 303. We scale up, we raise people, we train trainer, we multiply things. And if we invest in community, they will be the front line of resilience, and we will be able to reach out to them, and they will be able to reach out to us for help, for knowing what is the latest knowledge on vaccine they should know, and they will be able to share good use data, infra-local, where we know where inequalities are. So really, let's invest in not only the public health workforce, but the whole public health workforce, and even more the one that are doing health without knowing. Because we all know, and we say, and we know public health is not, and prevention is not with healthcare, but are they in the room with us? So we are publishing a supplement of the European Journal of Public Health of co-benefits of health in other sectors, and we hope this implementation journal will help you to go and find other people. And I really, really would love to see if on our next meeting, we did that with the CDC last year in European Public Health Week. How do we invite NATO? How do we invite ERA? How do we invite mayors? How do we invite all the people who are doing health without knowing? And we invest together, and at the end, we spend less money.
Thank you. I love the idea of people doing health without knowing. Like, this is really enlarging that sense of public health community. Katharina Haug, you're Professor of Health Economics at Imperial College London. What's from that economics perspective, what's your perspective on the investments that we need to be making?
Yeah, so I think as an economist, really, what does it mean to have a resilient organization that can withstand shocks is really have the capacity to withstand and to deal with unexpected shocks in demand. So in the health area, this would be unexpected shocks to treatment, demand for treatment and demand for prevention. So what do we need to put in place? First, of course, is some slack capacity in the system, some spare capacity. So this is thinking very concretely about occupancy rates of beds. And of course, it's not about the beds, it's about the workforce that is attached to these beds, which is costly to hold. So there is some inefficiency, technical inefficiency in the process that we have to accept if we hold this spare capacity. Then, of course, it is also investing into processes that allow us to pivot quickly input factors from producing one good or service to another one. So, for example, having a trained workforce in specific procedures that allow them to pivot to the treatment of, for example, patients in respiratory distress. Should a next respiratory pathogen hit us. Then I think it's also investment in stockpiles. So these are stockpiles in critical equipment, PPE, and of course vaccines. Now the question is how big should that stockpile be? So the question is in the detail. And I mean, there is modeling tools and research evidence that we can generate on what is an appropriate stockpiling size. For example, work we do at the moment with Gavi on what should be the optimal stockpile for the Ebola vaccine that can be addressed with modeling. It's tricky though. And then I think the last point is, yes, to invest in a standing research capacity, of course, as an academic, that is a priority for me, have a capacity to quickly generate evidence that is useful for policy making and that can be used to estimate model different scenarios. And then lastly, the capacity amongst decision makers to understand and work with this evidence to make the best decision for population health.
Thank you very much. And I also, as a researcher, I'm never going to argue against the need for more research. But I love how that you put some real flesh on the bones of, yes, we need the money and we need the investment, but how do we use that to really ensure that we have the right capacities in the system and the kind of evidence and analysis that can be used to answer those questions? Thank you very much for that perspective. Joe Simmons-Isler is Executive Director of Governance Strategy, Portfolio and Biosecurity at the Coalition for Epidemic Preparedness Innovations, that's EPI. Welcome. Probably taking a sort of, you have a sort of large vision perspective on the kind of investments that are needed, I imagine.
Yeah, thank you, and thank you very much for the invite. I think conceptualizing resilience is really, really important for this discussion. Resilience is not something you switch on and off. It's something you build, you work towards, you practice, you learn, and that is very connected with how we like to think about response. Response, again, isn't something you just do at the point of an outbreak. It's something you get yourself as ready for as you can be. And we like to think of sort of more of a dynamic state of readiness as opposed to preparedness. It's more active, it's more purposeful. Very quickly in terms of CEPI, so Coalition for Epidemic Preparedness Innovations was born out actually of the Ebola outbreak in West Africa, where the tragic failure to prepare for a foreseeable infectious disease caused the loss of 11,000 lives, and people agreed that we needed to set up an organisation to tackle a known market failure where vaccine development for epidemic diseases where there is no market are not developed. And so for us, of course, investment in medical countermeasure development is fundamental. That has to be connected with trust, with community engagement and all the other key issues. And I think we have to view this through sort of a global health security connected with regional security and regional benefits. And I also think conceptualizing the issues as not just ones of health. I mean, pandemics and epidemics are health issues, they're security issues, they're economic issues. And by separating ourselves into boxes of different communities with different boxes of efforts, you limit the overlap and potential to work together. And so from our perspective, I mean, there's a lot that Europe is doing, which is great. There is a really strong opportunity for a leadership role to both recognize the threats, to build capabilities in the region. The MCM, medical countermeasure strategy and stockpiling strategies in June are great. We're also really glad to see that the EU is focusing not only on the technical scientific elements, but also the equity element, that there is a need for equitable access globally. No one is safe until everyone is safe. And so I think a mixture of a focus on medical countermeasures, resilience being conceptualized in the right way, and thinking in advance of an outbreak, what might you need to do, and practicing to get towards that is the mentality everyone needs to have.
Thank you very much. And indeed, that idea of resilience is something that you build, something that is constructed over time, and the potential for that European leadership role. European leadership, that's all you lot. This is Gastein, so we have the right people in this community as a starting point, even if we then need to reach out beyond to the broader community. Olli Hoyer, as head of unit for One Health-related diseases at the ECDC, I'm very familiar with these kinds of challenges, and you have that European perspective that Joe was talking about. What kind of investments do you see as being key?
Thank you. Yeah, first of all, I think we must repeat and realize that public health is part of health security, and it's a very important part. The infectious diseases at large, and specifically the pandemics to come, will pose significant challenges to health security in Europe. And based on the experiences that we have from the COVID-19 pandemic, which was a major lesson learned, I think, in the whole area of public health, we must increase our ability, must invest in that ability to collaborate across the sectors. So intersectoral collaboration is very important, and this is what we must train and build up. With data from these different parts of public health, so actually both the animal side, the human side, and the environmental side, these data we need to collect in a way that they are interoperable, that we can make joint conclusions based on a One Health approach, and that we are able, in the end, to make a joint assessment of risk. So these are the areas that I see as foremost to invest in terms of the threat from infectious diseases and the pandemics to come. We need to, of course, then build more expertise. The workforce needs to be educated, as we heard. And there's a number of investments that needs to be like technical, more practical investments that needs to come. An example is from the pandemic, where EU money were invested massively in the capacity to sequence the virus isolates of COVID-19, which enabled us to keep track of which variants were upcoming. As you may remember, when we came towards the middle or end of the pandemic, it was all about the variants. It was all about which variant is now prevailing and what is the capacity, the ability of this variant to infect and spread. So this became important, very important information, and the build-up of that capacity in the member states was then absolutely crucial, instrumental in our ability to track these variants. So that's another area, as example, where we would invest. So in order to then operate in this One Health perspective, we need to train in peacetime to do exercises where we collaborate between the sectors. We need to do that in a One Health perspective with simulation exercises, and we need to preserve what the countries have learned during the pandemic. In each country, lots of experience was harvested in how to collaborate across. And now, probably in many cases, people will think, yes, we know each other, we know who to call, but actually this knowledge needs to be preserved, it needs to be kept, trained, and made available in the next pandemic. So the resilience and the build-up to keep a good health security in Europe is actually driven by science-based investments. And if we should succeed, we must build trust, we must share our data, and we must build that cross-sectoral collaboration. Thank you.
Thank you very much. Let me come now over to you, Raquel, and to the sort of, what have we heard from Slido from any other comments? So we've heard from the panel about their range of different investments that might be needed. What are some of the comments that you've seen online?
Thank you to those that are joining us online and that are engaging through Slido. We've had a lively discussions with comments around how political decision makers should or need to engage with data and key facts. And there is one question that has become the most popular question, that is that we are hearing a lot about the investments that we need to make, but actually the pot of money available is quite limited. So what is what we need to deprioritize?
What do we need to not do? Okay, I'm gonna. We will come back to that one. That's a great question. However, there's another topic which I'm slightly surprised that hasn't come back yet, but maybe that's because this is a room of very nice, optimistic people, which is, you were talking about what we learned during, several of you mentioned what we learned during COVID, and you mentioned it as well in your introduction, Pamela. But it occurs to me that we actually knew quite a lot, about these kinds of issues before we had the pandemic. And we know a lot now, but we also, in a few days of discussion already here in Gastein, I haven't heard a huge focus on these kinds of topics. So I guess the key question that I want to ask is, if we think that we know what we need to do, but we know, as the questioners have pointed to, that there are limited resources and there's a lot of competing priorities right now, how do we secure the political will to actually make this happen? How do we keep on, Joe, as you put it, how do we keep on building resilience in advance of when we need it? How do we engage these different communities? Ollie, I don't want to, forgive me for coming to you first on this tricky question. How do we keep this political focus, do you think?
I think from the point of view of those who provide the scientific evidence, we must make sure that the evidence we provide is reliable and sound, and it is timely. And we simply must invest in our ability to produce that evidence. And that is, as I mentioned earlier, the interoperability of data to create surveillance systems that actually catch the data and can present them, that we can collect them, process them, and make evidence-based assessments of the risk to present to the decision makers. Our role at ECDC, of course, is to assess the risk and present this to the member states for them to take action, or to the Commission for them to take action. One of the things that we have excelled in the past is to accumulate the evidence and provide options for response. Mm-hmm. One of the things where I think that we can even add another layer, and that I think is coming in many areas. Of course, we are using modeling as much as we can. We do foresight. We can soon even probably do longer predictions, and also nowcasting, as we say, which the data is three weeks old. We can then forecast what is actually the situation right now. But and on top of that, we should put one more layer on, and that would come from health economy. In order to provide decision support tools for the decision makers, where we do not only present, there is this problem, these are the options for response, but also the layer of what will that option cost, and eventually, what does that option cost, and how many lives will it save? Mm. And there, combining the disciplines, I think, is a future that will put our scientific advice at a higher level.
What a good thing that we have a health economist on the panel to talk about how we understand that, because the question from the online audience is very pertinent to this, which is that we have very limited resources. How do we understand what we're going to do? Because that also means we're not going to do something else, right?
Yeah, so I get the difficult question.
Of course.
We are all familiar, I think, with economic evaluation now. It has matured 20, 30 years. People are used to reading cost-effectiveness analysis from new therapeutics or new diagnostics, or also of complex public health interventions. But these evaluations are often, due to lack of data or also methodological complexities, these evaluations are often done from a health provider perspective only. So what they not consider often is the costs and benefits to patients of interventions, and the cost and benefits to the wider economy. And of course, we have seen during COVID how deep and probably very long-term the macroeconomic impacts of disease are. And that's why I think we need to redefine economic evaluations and health economic evidence towards a wider macroeconomic perspective, that it is done from a societal point of view. And this doesn't necessarily mean that we would recommend increased investments in certain pandemic preparedness interventions. We may even suggest lower investments. So I firmly believe that return on investment calculations and economic evidence should not be an advocacy piece for certain investments, but to give good and honest guidance to policymakers where to maximize health outcomes. I think it's important to do that, and also to present the uncertainty that is related to the evidence that we are generating for policymakers, and to train a new generation of decision makers in these more complex analyses, I think is very much part of that agenda as well.
Thank you. And hopefully that kind of just, being part of this is exactly part of hoping to have that begin that kind of engagement. Joe, you are, part of the point of CEPI is to be making exactly this kind of case and keeping that political priority, right? What's your key solution for us?
Yeah, I mean, you have to recognize the risk profile, I think. It's very easy to view COVID-19 as an aberration or a one-off, but the reality is epidemics and pandemics are increasingly likely in the way we organize human society, with travel, with urbanization, human and animal proximity, climate change, natural outbreaks, risk of accidental or deliberate outbreaks. And so I think conceptualizing the risk profile and the problem in the first place is critical. It's not just something that happens once in a while, it's continuous. I think the impact is an important part of the story. I mean, even everyone talks about the economic impact of COVID. Even the Ebola example of 2014 to 16 was estimated at over $50 billion of damage to the global economy from an outbreak primarily in West Africa, with some cases leaving. So I think there's recognizing the risk and there's articulating the impact. I do think, actually, in the space I work, there is a positive way of presenting this. Telling everyone why stuff is bad lands a bit, but it doesn't. They always then want to know what the positive case is. CEPI, with others, has helped catalyze the idea of the 100-day mission, with the logic of a moonshot. If for COVID-19 we had have had a vaccine within 100 days, it would have been over 8 million less deaths. And if you take that logic that speed is the biggest thing that helps reduce the negative impact and also increases equity, I think that's a compelling mission you can work towards. And the moonshot analogy is intentional. It's not something we can do tomorrow. But if you try as much as you can, if you invest in the right way, if you actually build on the scientific advances we have, I mean, through COVID, there were huge advances in vaccinology. We know most of the viral families. We know that dedicated investment in coronaviruses and in the messenger RNA platform years in advance were why we could move quickly, and you can apply that logic to multiple other families. So I think that's sort of the framing that I would give, kind of recognize the risk, be clear-eyed on the benefits, and view there actually as being a moment of opportunity.
Thank you. From the public health, again, part of your mission is keeping this political will in place.
Yes, and first thing is money, indeed. And for instance, we lost the grant that we signed, and we lost the grant. Sorry, I'm a little bit talking about a lot, but it was really weird to sign something with the Commission and then being it cancelled. We had to close our Brussels office because we couldn't pay for a policy officer anymore. So that's a problem. But we have solutions because we're trying to be optimistic despite all the evidence. So for one thing is money, how do we cooperate more? And I don't care if I'm not in Brussels as long as I'm cooperating with other NGOs. We can share a seat at the table. We can amplify the same message. And that's something that we're good at doing, and we're working on it. And let's do it together. And for the MEP interest group and all this kind of thing, we can do things together and spend less money on that. The other thing is that return of investment on public health. We know €1 invested in public health saves 7, 8, 14 euros in healthcare. We've been saying that, I mean, for myself, been saying that for the past 12 years. Did it change? Not sure. I have a mechanism that I've been trying when I was in politics in France, trying to push really high on the political agenda. It's 1% for health. Any other policy is going to win from prevention. Everyone is winning from prevention. So if we say any policy you make in urban planning, in agriculture, you pay 1% to have the public health experts, implementation science, and the public health people putting the lens and the glasses of public health, and you save money, you make better policy with public health. So you don't cut on spending, you take the spending of the other, because they are going to win from better public health, employment, and all of them. So this is a solution for money. Then unity, then implementation and citizen science, where we need interoperability so that we all share again. And last but not least, of course, disinformation. And we have a problem here, because we are not united in response to the farm hate boats that are tackling disinformation, that are pushing anti-vax narrative in Ukraine, for instance. And what do we do? Because we try to answer with our Blue Sky / maybe sometime Twitter accounts. Are we efficient? No. So one of my big plans, and I'm trying to find a budget for that, probably with a French NGO, Data for Good, is to create love boats instead of hate boats, and being systematical in seeing and evaluating all this misinformation online and answering together systematically with evidence, not with hate, but with radical evidence and radical community management together. I cannot do it with UFA. I have one comms officer. But if all of us, we share a moment and we share a platform and we say that this month or in the next 2 months we tackle this disinformation together, we can actually achieve something and use the same tools as the other with better results.
Thank you. And this theme of not just the evidence and the understanding, but the communication, I think is something that's come across many different elements of the discussion already this week. One of the key places where all of this comes together, of course, is the European Parliament. Mr. Courier, how do we keep this, this topic high on the agenda?
In this geopolitical situation, it's easy to forget how important health is, because there is an ongoing war next to the European Union. There is a trade war in the world, and I heard a very important sentence last year here in Gastein, that there are more and more evidences that where healthcare and access to healthcare declines, the support for extremist and populist parties grows. And this destructive power can take an advantage when we don't put enough attention and support to our healthcare systems. And at that point, and I would like to repeat Director Randy Wagner's words, that health is a security issue. And I think that's the key, how we can keep the budget and the focus and the importance the top of the agenda in the European Parliament. And actually there is a political will, and the proof is that now we have a public health committee as a full committee with a full legislative power. Mm-hmm. But it is true that we have to fight every day to highlight and underline how important this topic is, because it's easy to forget, especially when people tend to forget that how life was 150 years ago, when the newborns infant mortality rate was 20%. 20% of the kids died before their first birthday. People don't remember this, even the decision makers. And that's where the data and the evidences must be shown, and not only shown but also translated to understandable form, because it's like the information around us, that we have the sound waves, but if we don't have the cochlea, then we cannot hear the voice and understand what we say to each other. So we need to transform this data and information to a very understandable way, which proves that it is a security issue. And I think that's how we can keep the health in a spotlight and top of our agenda in the European Parliament.
Thank you very much. So, colleagues, I'm going to come to you in the room. So, I think you heard from the panelists about the importance of different dimensions, about the importance of money, about the importance of the social dimension, about trust, about community, the importance of understanding the costs and the benefits that are involved, some of the different elements that we need to make investments in. And we've heard now about, well, what does it take to actually achieve that? And about evidence, but also about communication of evidence and showing the relevance of these investments to the wider priorities of security, of competitiveness, of trade, and all these other different priorities, and how this preparedness is fundamental to these wider communities, to that engagement. Colleagues, what have we missed? What are the elements that you want to underline, either for investment or, as the colleagues online said, disinvestment? And is this enough? Will it work? Is this going to change the dynamic and ensure that we have the investment that we need? So, who would like to contribute to this discussion? Do I have people with microphones, please? Could I have... okay, take that one. Good. Would you say who you are?
Oh, yes, hello there. My name is Nicolien Thompson, I'm from the Netherlands. Yes, I think what we have missed here is that, also linking with this morning's session, in the US, at the other end of the Atlantic, public health is being weaponized and actively destroyed. The CDC is being destroyed. The National Institutes for Health, which you're part of, are being destroyed. It would be really helpful for the panel to reflect on the impact of that, because data is being destroyed. There is attacks on academics. And it might very well be that in 1 year or maybe even quicker, our European public health and health security organizations are the only ones standing and not yet being attacked. So I'm very concerned about that, and I missed it. We're not on an island, as we know. So how can we compensate? How can we make sure that actually we remain resilient? Because we were not prepared for the political developments in the US. And what we are also seeing is that the extreme right is winning in Europe as well. So it really would be helpful to have some reflections on that. Thank you.
Thank you very much. I think, Joe, you already mentioned, for example, about the opportunity for leadership, which I take as the most positively framed way of addressing that question. Yeah, please.
Thank you. My name is Siegfried Weich. I'm representing a program in economics and management with some European partner universities. And I'm glad to hear that we see a lot of benefit in the close cooperation between the agencies and the member states. But I'm also quite convinced that the comments on the global health dimension are extremely valuable. So all these challenges that we are facing need a global approach. And as Nicolien said, with these global tensions, it's very difficult at the moment also for the scientists to understand with whom can we still work together, whom can we trust. There is abuse of our cooperation possible. So I think we need a close cooperation also with the people who are in science diplomacy to make sure that we have some guidance in how to stay connected closely.
Thank you. Yes, please.
I'm Karolina Mackiewicz from the Global Health Connector, and one thing that also comes to my mind, and to follow on some points that were made in the panel, when I hear health literacy, we need to improve health literacy, then connecting to the trust and the misinformation, also dismantling public health system. One thing comes to my mind, an example from my native country of Poland, where there is political momentum. The government introduced the health education to the schools, but the way it was implemented and also the misinformation coming from the right-wing parties, making this health education subject, like presenting this health education subject as the sexual education, resulted that 90% of the pupils, in some classes, 90% of the school children dropped out from the subject. which meant that the political momentum was there. There was a campaign for increasing health literacy through the health system, but the way it was implemented and the information coming from the other side actually ruined the whole effort. So maybe also like some reflections from the panel, how to implement it better so that we are also prepared for the attacks from the other side. And when I hear we need more campaigns for health literacy, I always think like how to really do it, that it makes sense. Thank you.
Thank you. So just to reassure, but just to be clear with both you and with the panel, I'm not expecting everyone on the panel to answer all of these questions, all right? Yeah, I think we take these as inputs and then we will collectively see how best we can respond to the best elements of them. Please.
Yeah, hi, Martin McKee. So the question is, are we prepared? And I'd suggest that maybe we aren't, and I would argue that because we actually are at war. We're engaged in a hybrid war with Russia with profound implications for health. We've got the Russian shadow fleet sailing up and down the Baltic, cutting undersea cables. We have a torrent of disinformation coming from the St. Petersburg Internet Research Centre. We have cyber attacks like the one from the Killen gang on London hospitals recently, Polish hospitals. Estonia is under constant cyber attack. And this is all going on and we have our water supply, a dam in Norway hacked into recently, the destruction, the demolition of over 30 mobile phone masts in Sweden, almost certainly linked to Russian saboteurs. And this has huge implications for us in public health, and I'm not sure that we're actually recognizing the state that we're in, and we're pulling together our resources. And we get a lot of calls to say we should invest more in, somebody said, innovative medicines rather than defense. Okay, there are lots of things we could invest in, but I think we actually do need to invest in defense at the minute, because that actually is a strategy for saving lives, just like all of the other things we do in public health. I know that's an unpopular opinion, but...
Thank you very much. And is there one over there? Yes.
Yeah, thank you very much. This is Sier from Heidelberg University. I just want to build on what our friend said about the US politics and the recent policies. I also want to ask the panelists to shed light more on we, of course, when we talk about health security, we know that health threats don't recognize borders. So not only from the US side, I also want to know what would be the role of EU, or how can EU strengthen the collaborations with also low-income countries to build more or global preparedness rather than just European preparedness or regional preparedness. So I want to listen the insight, what would be the good strategies to look more to it and look more globally into it, not just at European level.
Thank you very much. I know there are other people that want to come in. I'm going to come to you one last time for the online community as well. Are there any other key comments or questions that we should bring in?
The online community has been very active. Thank you, everyone, for your contributions also online. Lots of interesting comments and topics. To highlight just a couple, the need to go beyond political agendas and ensuring we tackle all these challenges we are discussing about with public health policy. Also, another important topic that has been mentioned by a few is this investment in health literacy and ideas such as working with other sectors that might be contributing financially to support strengthening our health literacy actions, maybe schools could support investing on this. And the other topics that have been discussed here is maybe things like the pandemic treaty might help Europe respond to better future pandemics, and ideas around the strengthening of the single market for medicines and how this might contribute to improving health security and the resilience of our systems. To close our top questions, there is one that I think has been mentioned in quite a few sessions during this week here in Gastein about artificial intelligence. And this question focuses on asking the panel, what do you see as the future of artificial intelligence, particularly for health security, and where specifically do we need to invest now?
Thank you. Right. So if you thought that we had a nice set of investments and a shared commitment to political will, I think I'm going to describe that set of inputs as a bracing dose of reality about some of the challenges and the difficulties and the completely different nature of the context that we're facing. So I think there were times in the sort of the long history of ECDC sessions in Gastein where we could have said there is a very shared commitment to public health. And I think, so one of the key themes that came out of this is even if we feel that that's part of our European social model, that there are very difficult external circumstances, some because of overspill of domestic debate, some of them very intentional and very targeted, actually. And that this is also a question of what exactly is that contested social situation within Europe, and some of the different values, as well as we heard about different priorities before, and also maybe what are the broader range of tools that are available to us, technological and regulatory, and the opportunities of Europe. So no pressure, colleagues. Small set of topics that you might want to talk about. And what's at stake if we don't get it right? So, Charlotte, do you want to go first?
I can go. If we don't get it right, I think you said it, the stake is what is going on in the United States. It's terrifying. I'm properly terrified. And what do? Well, we do statements. I believe it's not enough. We connect a lot. I believe it's not enough. And while I said in different places, I really think public health people should run for office because public health is politicized. And if we don't want the people not knowing about public health to do bad decisions in politics, we should run for office. We should support more the member of parliament internationally, but nationally. I mean, for some decision in the National Assembly of France, I personally wrote to every member of parliament that stood up against fascism for different reasons. Because we always know how to say to people we don't like that we don't like them, but we don't unite again, and even to our politicians. Sometimes we can help them. We can organize at community level because it's where it happens. And yes, I mean, the Poland example is a very good example. It happened in France too. We had a huge backlash on education about the woke culture, and we're going far right really, really fast. The other thing is that we must not be naive. Who is paying for that? I mean, there's a great article on the British Medical Journal about weapon industry being one of pushing for war. I mean, follow the money on that. The old Tylenol issue, there's lots of things that we're like, oh no, it doesn't cause autism, we have the science, but we don't see the political behind. So we have to stop being naive, we have to fight more. So I don't know if we should make karate session in Gastein, but I really think there's something about political courage, but also speaking up and speaking up to other people and supporting each other. Because speaking up alone is really hard, and you fear and you feel like people are going to criticize you. And in some government, we have members in 49 countries of the EU. Some members of UFA are really threatened. But if we stand up for them and with them and systematically and support them systematically with science, with good evidence, probably we can make a difference. But if we don't coordinate, I think we're going to war.
So the title of the forum this year is Rethinking Solidarity, and what you're calling for is solidarity within and between the community, if I understand. Yeah. Joe.
Yeah, the stakes are higher and the environment is extremely turbulent, and being deaf to it is extremely naive. I think there's different elements to it. I mean, there are areas where absolutely people should be engaging with standing up for evidence and understanding both the first order and the second order impacts. Sometimes the thing that is happening first of all, actually the thing that follows will have a bigger impact later. At the same time, and this is self-serving probably, but I do think there is a case in a very turbulent environment where you actually have scientific advances that you know can make progress. You should continue with those in spite of the context, and actually where you think you have progress towards solutions, you should really lean into those. I started earlier on talking about the different communities. I do think it's incumbent on everyone to be a bit more open to understanding different communities. You hear concern about securitizing health. You hear concern about healthifying security. You hear people say the 100-day mission is too fast. You hear the security people say it's too slow. And I think there is a risk by being divided between communities when the Venn diagram of interests is so great that we will fail to have the impact we want. Again, on the military side, I mean, resilience is in the title. There's a common discussion sort of in biosecurity or resilience terms on the idea of deterrence by resilience. So in the space I work in against infectious diseases, by having vaccines ready against diseases, you reduce the threat of them being weaponized. And so I think resilience, but deterrence by resilience, is an extremely important concept. And on the last comment, on the cost of inaction, I mean, I think it's a helpful exercise to think forward and go 5 years, what are we going to wish we had have done now? Like, we have all of these learnings, we have all these reflections. Imagine 2030, and imagine there's another pandemic or something goes wrong. What are the things we knew what to do, but we didn't make them happen? And how do you inject that sort of future to make you make the right decisions now?
Thank you. And just to be clear, so when you talk about different communities, you're talking about health and defence in that context. What do you just to say 2 words more about that?
Yeah, health. I mean, so CEPI is funded by all parts of governments. In some places it's education, in some places it's foreign affairs, in some places it's development. And I mean, we even find it hard with many governments to get them to connect across government. And so, yes, there is probably a starker health and defence piece, but I actually think it's broader.
All of government.
Yeah.
Cool. Thank you very much. Building on that point about so in 5 years' time, there'll be a new European Parliament. And you'll be going out and saying, this is what so building on Joe's point, you know, what are the things that you want us to, you will want to see happen, as it were? What do you want to be able to talk about in time for the next Parliament?
It is a very, very difficult question because the problem is that the health is a member state competence and we have limited power, but I think we already started many programs and initiatives which show that we can strengthen the collaboration with the Beating Cancer Plan. Now with the Critical Medicine Act, we just started a new own initiative report on healthcare workforce shortages. So these baby steps, maybe we can achieve something, but if I may, I would like to answer a bit to that US-related question that, yes, it is frightening what's happening with the science and how the public opinion has changed related to science. And I think it should be alarm for us to see how important this issue is, but also it's an opportunity for Europe, because if we can show to our scientists and researchers and even companies which invest in research that Europe is a safe place with a predictable future and not an unpredictable environment, then maybe we can reverse the brain drain and also to bring here those innovation and investments which were suspended and will be suspended because of this unpredictable environment in the US. And one more comment back to the health literacy and education. I think it's both easy and difficult question because we see good examples, and I think we should empower our healthcare workers and also scientific and scientific institutes and agencies, for example, like ECDC, because ECDC already have very good educational programs, and by supporting this, we can reach those citizens who are very skeptical or hesitant, but and we founded with my colleagues a health and science education course at Semmelweis University to actually to teach the math students how to communicate on social media, on the internet, how to respond to these questions on the internet, and the difficult part is that before you want to tell something or you want to convince somebody about something, you have to build up the trust. So when there is a pandemic, you are already late because you have to build up that trust before the crisis. And that's why we should support these programs to build up those health communicators, those programs which start to build up the trust, because it is very important when there is a new crisis. So I think that's the way, and maybe not by a government it's a shaky topic, so I have to be careful because I don't want to hurt anybody things. But so I think we should empower the scientists and the healthcare workers and the scientific bodies and agencies, and that's how we can do this. And not with the politically driven health education program, which biased by some ideological things. So that's a very difficult part. Sorry for being so long, but this topic is very close to my heart.
To everyone's here, I think. You mentioned building up that trust and the role of those expert and scientific institutions. Ole, that leads me very naturally to you.
Thank you. So for the topic of inaction, of course, in prevention and control of infectious diseases, inaction is counterproductive. We saw that during the pandemic. Inaction leads to fragmented response, it leads to delayed detection, and there was a large economic effect, or detrimental actual economic effect in some cases. And we were lucky, still, we were lucky in this situation, as you said before. The vaccines came much faster than we had thought. And actually this pathogen that we were up against was not as deadly as it could have been. And we could imagine future scenarios with a much more potent pathogen, or even multiple introductions from the animal environment to the human side. Now this was different in COVID-19, but still the costs were high. But there are things actually that we could do. Now we'll mention one more example. I mean, there are grim estimates that say that millions of people will die from antimicrobial resistance by 2050. And here, prevention, of course, is the key word for the pandemic preparedness. It is preparedness that needs to be built. But there are things we can actually do without increasing the cost so much, but just working on what we're already working on, but a bit a different way. So if we build that intersectoral collaboration that I mentioned in the beginning, that will increase our ability to withstand the crisis. There's currently an initiative by the 5 EU agencies that were known as the ENVI agencies, so that's ECDC, EFSA, EMA, ECHA, and EEA, where we went together and work now in a cross-agency One Health task force. Now this is a model that we would like actually to export to the member states. So some member states already have this kind of this intersectoral collaboration established, but it is a model that kind of facilitates a forum for that exchange of data, exchange of knowledge, and joint decision-making that is needed. And I would dare to say that if the countries get that right, if they start that, then that One Health collaboration is actually a precursor to a much larger crisis management forum, where you just need to add the civil defense, the police, whoever other actors is needed, depending on the situation. And once you have established that, then you are much better prepared for the next crisis. But there's some way to go, I think, all over, also at the European level. And one of the reasons is, of course, that for each agency, and that's the same at national level, each agency was placed in its own sector, with its own mandate, with its own legal basis. But now, coming out of the pandemic, we realize that we need to work together, and we need to bridge that gap between us. And this is the challenge. But this, of course, collaboration costs time, and time costs money. So there, it's not for free, but it is not something that immediately has a huge investment. And I think we are already on the way, and we know from many member states that they have the same thoughts and they're working in the same direction. Thank you.
Thank you. And Katarina, last but very much not least.
Yes, so I want to really talk about 3 questions and issues that were raised. So first, on the US politics, I think that the withdrawal of funding will have drastic impacts on health, particularly in low and middle income countries. I think there's modeling around and research evidence that shows that that is the case. I think it will also have the consequence that there will be much less investments in prevention, because countries may be able to pick up, and already doing it now, support treatment for the big, for example, the 3 big diseases, the 3 big infectious diseases. But what will fall back on the wayside will be preventive interventions that were covered by PEPFAR and other organizations. And but I think it's also, like what was mentioned before, a call for countries to step up. And I have heard that there are already some countries that are where the Treasury, who, as we know in many low and middle income countries, are making decisions on health as well, are stepping up and saying, okay, we need to increase the fiscal space for health. So I think that in itself is probably a good thing. Then on the second topic of health security, I mean, we do quite a lot of work with Singapore, with government officials there, and famously government officials in Singapore are very well paid. And they, and I'm stunned, first, how they see the issue of health security in a similar vein as defense. And that, and also the second, what I'm surprised about is how collaborative the government officials are across different organizations. So the Ministry of Health and also Ministry of Manpower, which is looking after the workforce, are working very closely together. And they're very much advocating also pandemic preparedness exercises, which of course we are at the moment doing as well in the UK, where you have like a red team that hits us with a really nasty virus. In fact, that's what they're doing. And then people in the blue team trying to combat that, and then draw lessons learned from this, I think, which are really interesting. And then the third point, I think, that Martin here made on the economic evaluation, on the cross really investments into other areas that are increasing or improving health, and that potentially investments into defense, and I may want to add investments into climate, might be better investments on some occasions than investments into traditional public health interventions. So I think it's very important to have metrics that can be used across the different areas of government spending, and then do assessments that really allow us to decide where are the best investments into population health.
Thank you. Colleagues, I feel like we had a discussion on at least 3 different levels. I feel like we had a discussion about a very real recognition of the kind of environment that we have for health resilience and the investments that we need in terms of the global context, in terms of the threats not just to health, but to our whole way of approaching resilience and the assumptions and the basis on which that rests within European societies and globally. I feel like we also, though, had a really actually very optimistic discussion about the technical content of how much we've achieved already and what the opportunities are that are coming. We managed to avoid talking about AI, which may or may not be a bad thing. But we did talk about some of the different ways in which we understand the investments, about data, about the kind of infrastructure and societal mechanisms which are already in place and which are such a solid foundation on which to build. But I want to come back, I think, because the third dimension that came across both from the panel and from Pamela's introductory remarks was about really the theme of this conference, about the social contract, about what resilience means and about what it is rooted in. And it is rooted in technical public health infrastructure, but it's rooted in a set of communities and values and systems, and even with all the challenges that we've heard about within member states as well, we still have, Pamela, as you said in the plenary as well, if you look at Europe in comparison to the rest of the world, we still have the infrastructure and the institutions and the fundamental social contract that I alluded to at the start, which gives us the best possible base to build on, even recognizing the challenges at the moment that we have. So I think our panelists gave us insight into all of those three dimensions and also grounds for optimism about how we, as part of the wider public health community, can work together in addressing that. My thanks to the ECDC for being both the guarantor and the anchor of this within Europe and for convening this session. And please join me in thanking our panelists and the ECDC for organizing this discussion overall.